Hey guys, I'm David Demuzio. Welcome to Hair Loss Hope, and this is my friend Dodge. Dodge is a nurse practitioner here in Dr. McGrath's office in Austin, Texas. So now he does hair transplants pretty much every day. Today you're doing 2 of them, right? And before he started working with Dr. McGrath and doing hair transplants, he specialized particularly in hormone replacement therapy. So I wanted to ask him about this peptide that I've been hearing about, which is BP157, and how it relates to muscle growth and hair loss, and sort of his thoughts on it and experience with it.
Sure. So BPC 157, it's actually it's a peptide that's made in the gut, and really where it kind of shines is actually helping some people with gut issues like leaky gut. It can help with healing with that a lot. But where it's been getting a lot of attention is actually with healing in general. It can help things with like tendonitis and other things like that. I actually tore my left bicep a number of years ago, and by using BPC 157, I skipped surgery, and I was actually able to do pull-ups within a couple months. It really doesn't do much in terms of muscle building, but definitely helps significantly with healing, which is where with hair, there have been some small studies done where it's injected subcutaneously throughout the scalp, and then there's microneedling done, much like some of the other things you're seeing on the internet these days, and it has some modest improvement. It's not to a place where I'm ready to start using it just yet or suggesting it to my patients, but I'm definitely watching it. I'm definitely considering it. And if it comes to a way that it's easier to use and I see promise, then I'll definitely be looking into it for the patients.
It's mostly getting injected these days, like into tendons and like ligaments and all this kind of stuff, like for healing.
It doesn't actually have to be injected into, say, the tendon or into the joint. It's pretty good at being systemic. Now, obviously, if you're trying to help with, like a knee joint, it's a little better to try to actually put it in the joint. I would not suggest doing that by yourself, but there's not a lot of blood flow going into into cartilage and tendons and things like that. So that can be a little bit of a tricky thing. But when it's injected subcutaneously, it doesn't even necessarily have to be at the injury site. It works pretty well systemically, and it's also something that is pretty well absorbed into the gut. So it's one of the few peptides that's not going to be broken down by the stomach acid, and you can actually do it orally. Although I found, and many other people I've spoken with, patients wise, they find a better result when they use the injectable versus the oral.
Okay, gotcha. So there's some anecdotal evidence that it can be helpful with hair.
Yeah, I mean, there's actually, some small studies. Usually it's in using, also kind of putting on some topical minoxidil and things like that as well. But it's very promising potentially for using in conjunction with other things for hair loss, for sure.
How readily available is it in the US?
That's kind of one of the tougher things is there's only a couple pharmacies. There are starting to be more, but there aren't many pharmacies that have it available, and it's always going to be in a compounding pharmacy.
Okay. And how often would you need to use it to see some kind of potential results with hair, right? Any information on that at all?
I mean, in the studies they were doing it, I think they were doing it 5 days on, 2 days off. You wouldn't want to microneedle every day, obviously, because you're risking scar tissue and things like that. But typically they would do that, and then for a day or two they would do the microneedling, let it heal. And I believe they did it for 2 weeks.
Have you had much experience with your patients or doing microneedling?
I have it a mix. When it comes to the microneedling, the biggest thing is you don't want to go hard on it. Like people they see something, they read a little bit of data, believe that it's going to be helpful, and then you start microneedling every day. And I've actually had a patient who had a phenomenal transplant. And when he started doing it daily, he came back and he had scar tissue all over the back of his scalp. He had scar tissue throughout his hair transplant, and it was horrible. So we actually did an FUE on him, and we had to be very careful with where we took the hair just to try to uniformly fill in some of these new holes. And it was heartbreaking because the guy, he knew that it was his fault, and we just did the best we could. And he's actually come back. We're at 12 months now, and he's done a lot better, and he's definitely not doing any more microneedling. But in saying that, once every 10 or so days, you don't want to go more than probably 1.5 millimeters deep. There is some studies showing that it could potentially help some with hair growth. A lot of time, once again, in conjunction with using some other products.
Thanks for watching, guys. I hope you'll click the like button if you got something out of this video and enjoyed it. And if you have any questions or comments for us, please leave them below and we'll definitely get back to you. Hey, what's up, guys? I'm down here performing at Mahu Sinesta Beach Resort here in St. Martin. And I brought these right here with me. These were made by my friend Brian, who I went to Brazil with last summer. and these are his hair fibers. He did a ton of work trying to find the best formulation of hair fibers, and this is actually a video right here. This is real time, 27 seconds, including him putting it on, patting, combing, everything. 27 seconds, what these do for your hair. It's pretty incredible. So I brought these with me because I'm performing here. Super bright lights. I want to feel my most confident from every single angle, no matter what lights are shining on me, and these do it for sure. My hair looks awesome when I use these. So I think this is one of the most underutilized things for guys with thinning or thin hair. You can use my code. My code is HOPE. So if you go to the link in the video description and use the code HOPE, you will get 25% off. That's my affiliate link. I'd love you to support Brian. Get something that you're definitely going to use and is going to improve your life. And yeah, HOPE 25% off. See ya.